Hi, I'm Gregory Pope. Welcome to SaveYourHeartInMexico.com. Today I'm in the town of San Miguel de Allende, Mexico. It's a colonial town about 1,000 miles south of the border. And a lot of you people that'll see this probably live here in San Miguel, and some will be international. This is a part one of two-part series. Today I'm going to go see Dr. Casal. He's a cardiologist here in San Miguel, and he's going to recommend me probably to go see another doctor in Querétaro. There are two doctors that are top doctors in Mexico. I'm going to introduce you to him. I would highly recommend that you see him. There's a lot of people that we've all seen the commercials. Check your pulse and see if you have AFib or whatever, but that doesn't go to the root to see a lot about your heart. And I'm 65 years old, I've got grandchildren, and I really want to make sure that I'm going to be healthy in the future to be able to see them. And the best way to do it is to have echocardiograms, EKGs, and possibly a CT coronary where they can actually see the calcium scores inside the veins and arteries, so that make sure that I'm in perfectly good health for the near future. So thank you for watching the video, and I'll be introducing you to Dr. Casal shortly. Hi, Dr. Casal.
Hi, how are you?
It's good to see you today.
Good to see you too.
As I said today downstairs, I came to see you today because you did an EKG on me. You did an echocardiogram. Everything seemed to be, to a certain degree, okay.
Yes.
But we know that there's more to the story of those than just those two things, and so yes. I know that you probably would want to recommend a little more to make sure that my heart's in good condition. I've explained I'm 65 years old. I've got grandchildren. I want to be around for a while. I want to get to see them, and so I know that you're a member of the American Association of Cardiology, but could you expand a little more for me?
I am a young cardiologist. I have done my two specialties in Mexico City. The first one at the General Hospital of Mexico, and the second one at the National Institute of Cardiology, probably the biggest hospital in Mexico who is treating patients just with cardiovascular conditions. Over the years, I got a lot of experience. I also did a master in echocardiography in Francisco de Vitoria University in Spain, and I am a member of the American College of Cardiology. So we have done a lot of studies and things
very extensive.
Yes. So well, and basically, as you well say, it's something. Sometimes analyzing a patient with just what we can see or the medical history that a patient has sometimes can be confusing. We all know people who we thought that they were very healthy, they were used to do exercise every day, and all of a sudden they suffer a heart attack, and sometimes can be a catastrophic event, sometimes can be treated in a proper way without any complication, but sometimes can change their lives forever. So in certain cases, we do a special test that is an analysis of the heart through a CT scan that can determine the risk of having a heart attack and a cardiovascular event during the next 10 years. So it is a very useful tool that wasn't there a few years ago, and that now we are very experienced in using it as a tool to predict and trying to reduce the risks of a patient who might be seen as a healthy patient, and that in some cases we can detect a patient that was about to have a heart attack, and we can prevent that from happening doing a procedure, a stenting procedure or something like that. Or sometimes we can be more aggressive controlling risk factors like controlling cholesterol levels, blood pressure, glucose in case of diabetic patients and things like that. So we can at the end prevent them to need any of these procedures or a cardiovascular event in the future. So
well, there are people that are, say, 50 years old that just fall over from what they call a widowmaker.
Exactly.
And they're not, they feel just fine, but
yes, a minute before they were fine, and all of a sudden,
the next minute they're gone.
Yes.
So it's, you know, there's, I know that you also see my wife. She had thyroid disease, and she'd been on taking T3 and T4 for many years, and it caused her to have an excessively large heart and problems with the valve that she had, and she had to wind up having a micro clip done. We wouldn't have known any of those things if we had not come and seen you and done all these tests. And so my point is I think that anybody that thinks they're in good shape and stuff like that, here in Mexico, it's not like in the States where you need to go and have a requisition to see a specialist and they charge you $500. I mean, you know, the cost factor here is so much easier and cheaper and can be done just right away on the spur of the moment. So, you know, I highly recommend that people do this.
Yes.
And I think at this time you would want to recommend that I have that CT scan. I think they call it a 3D coronary.
A 3D CT scan of the heart, and where we can do a special analysis that is called a calcium score. The calcium score is very useful to maybe at this point there's no a big clogged artery or something like that, but the calcium score can let us know what are the chances of having one in the next year. So this 3D coronary angiotomography is what we do to analyze this.
Okay.
So it's a very good idea. And yes, about there are many patients with some risk factors that can lead them to have many kind of diseases. There's not just heart attacks, there's other problems as valve issues and all of this that can be prevented at some point if we detect the problem in an early stage.
Then you can, there are methods, medications and stuff that might slow it down, the progression, and give them a longer, better life.
Exactly, of course.
So that's really great news.
Yes.
And so I highly recommend that you see Dr. Casal here at the Mac Hospital in San Miguel de Allende. And then I will go see, you're recommending Dr. Rafael.
Dr. Rafael Vera is a very good friend. I know him for many years now, and he is a very experienced doctor in cardiac imaging. It's the many techniques to do imaging of the heart, and is the guy that you want to see your heart in this kind of studies to analyze what's your risk and completely as a team completely see what will you need and what will be next. Okay,
Well, then I will make an appointment with him. We'll get the study done and we'll do an analysis and see how I come out. And on the video we'll be sure and put your contact information in where people can get a hold of you and start the process of trying to make sure their health is good for many years to come.
Of course. Great.
Thank you very much.
You're welcome. It's always a pleasure to help.
Thank you.